Okay, so now we're going to talk about the leg. Um, so when we talk about the hip and we talk about flexing the hip, we're talking about doing this, okay? Bringing the leg up like that. If we're talking about extending, we're talking about straightening that out. Just so you know, because when I saw flexes of the hip, I was a little confused by that personally. So I figure if I'm confused, wait, right? Okay. So we're going to start with the iliopsoas. Again, that P is silent, so it's iliopsoas muscle. It actually has kind of three pieces. You've got the psoas minor, the psoas major, and then the iliacus. Now I'm going to tell you something, and you're probably going to go, well, then why did you show it to us? Because I don't want you to be confused. The psoas minor exists in some people and doesn't exist in others. And to be honest, it affects the spinal cord more than it affects the legs. So I'm not making it part of this, just so that you are aware. Okay. It's just, I wanted you to see it so that you'd know what that was, especially if you're going through the tables by yourself. When I saw that, I was like, okay, but where is that? Why isn't it with the other psoas muscle? That doesn't make any sense to me. So just know that because it is in some people and it isn't in others, I'm not going to worry about it. So the iliacus actually does flex the hip. It brings your knee up. And this is it isolated because here it's kind of behind the major muscle. And then in blue, you've got the psoas major. The psoas major also involved in flexing the hip, bringing that knee up. And like I said, with the psoas minor, again, highlighted in blue, it's your vertebra mainly. It flexes the vertebra and then it can also, well, almost like doing crunches. But some people have it, some people don't. So I'm not worried about you knowing that for the practical. Let me put it that way. Okay. So let's move on. Okay. Again, we've got parts and pieces that are bone. So the anterior superior iliac spine, the iliocecal tract iliotibial tract is going to be a tendon, so don't worry about that. The tensor fasciae latae actually tenses the lateral fascia, stabilizes the femur, so it kind of keeps it in place on the tibia when you're standing. So it doesn't allow it to kind of move around on top of your tibia. It flexes the hip, so again, bring your knee up. It abducts and medially rotates the thigh. So abduction, take away. So now we're talking about doing that motion. Okay, we're taking it out. Medially rotates. So like when you're doing the pee-pee dance. And it tilts the pelvis. Okay. So that's going to be your tensor fasciae latae. The iliopsoas, like I said before, it flexes the hip. Even though we're talking about the psoas major and the iliacus, that's what that is. Pubis bone is bone. The pectineus. So the pectineus is going to adduct the thighs. So bringing your legs together. And again, flexes the hip, so it brings your knee up. The adductor longus. It's a long muscle, of course. But it adducts and laterally rotates the thigh. So instead of bringing your legs in like the pee-pee dance, you're going to be bringing your legs out. And it again flexes that hip, so bringing your knee up. The gracilis. So the gracilis adducts the thigh, bring them together. And it flexes the knee. A lot of these, if you look at their position, they're medial. This is an anterior view of your right knee, or right leg, I'm sorry, knee. I saw the knee, said knee. So these muscles are in the middle that I'm talking about. So adduction does make sense for their function. The sartorius right here, and you can see it goes across the front, okay? It flexes the hip, so it bends your knee. It actually also works on flexing the knee. Like I said, it wraps around, so doing the kickback where your foot can kick up to your butt, that's flexing your knee. Same, it flexes the knee. It rotates your thigh, but it rotates it laterally or medially. Again, if you look at how it's all the way across here, that kind of makes sense, because if I pull one direction, I would rotate lateral. If I pull the other direction, I would rotate medial. Okay, so down here, everybody's probably heard of the quads, right? The quads of the leg. Okay, so the quadriceps of your leg, the quadriceps femoris, are actually 4 different things. You've got the rectus femoris, the vastus intermedius, the vastus lateralis, and medialis. Sorry, missed one. So the vastus medialis, the vastus lateralis. Okay, rectus femoris has one function. It flexes the hip, brings your leg up. But the vastus muscles, vastus, intermedius, medialis, and lateralis, all of those extend the knee, so they straighten out your leg, okay? All right, everything else is either a tendon or a bone, or a ligament for that matter. So, moving on over here. Scoot this direction so I'm not directly in front of it. Yeah, okay. Again, bone. The gluteus medius. The gluteus medius, I'm having a brain fart. Actually, there's a better picture of this. Hang on. Yeah. Gluteus medius up here. It abducts, takes away, and medially rotates the thigh. It tilts the pelvis toward the muscle. It supports the thigh and basically stabilizes your pelvis. It keeps everything stable. So again, going back, that's the gluteus medius. Gluteus maximus, which is actually pretty good in this picture. So I'll just do this real quick. Whoops, there. Okay, just in case you want to see an up-close personal view of it. The gluteus maximus actually extends the hip, so it straightens out your leg from this position. It abducts, which if you look at how it's situated, kind of makes sense. And it'll laterally rotate your thigh. Okay? All right. The adductor magnus. So what does magnus mean? Big, right? Adduct, bring together. So the adductor magnus actually has 2 parts to it. I'm going to flip real quick. It's got kind of this fanned region, and then it's got this kind of string region down here. So you've got the adductor magnus, there we go, that abducts the thigh, brings them together, A-D-D, add, and it flexes the hip, so it does this as well. The hamstring part, though, this long string part here, actually extends the hip, so it straightens out the leg, and it adducts the thigh. So both of them do the adduction, but one flexes, one straightens, okay? So that's the adductor magnus. The gracilis we just talked about. Again, the iliotibial tract is tendon, don't worry about it. Now the hamstrings. The hamstrings are a group of muscles, okay? Kind of like our quadriceps femoris, okay? So you've got the semimembranous, the semitendinous, and the biceps femoris, of which you've got a long head and a short head. So the semimembranous, this one, flexes the knee, so it bends your knee. It medially rotates your leg. So, okay, before I forget, thigh from your knee down to your ankle is leg, okay? Sorry I didn't mention that earlier. Kind of wasn't thinking. Okay, so we've got medially rotating our leg, and it actually does tense that capsule around our knee joint, okay? Now, the semitendinous, this one, this also flexes your knee and medially rotates your leg, but it can extend your hip as well. The biceps femoris, regardless of long head or short head, flexes your knee, okay? Well, I can still have a straight leg and flex my knee, and laterally rotates your leg. So again, taking your toes and facing them toward the corner, okay? And then it extends the hip, so it straightens out your leg. Okay, so we went through that. The gluteus maximus and medius, we went through that. Okay, so a lot of this is bone parts. Posterior iliac spine, origins, which the muscles aren't there, but that's the origin of the gluteus maximus, sacrum's bone. The superior gemellus, okay? This is going to laterally rotate and abduct out your thigh, okay? All right, iliac crest is going to be bone. The origin is the origin of the gluteus medius, but there's no muscle there. The gluteus minimus, okay? This abducts and rotates medially. So the thigh. So abducts, takes it out, right? I'm getting a workout. Yeah, I know, I'm sad. Just go with me on it. It rotates medially. So again, with the pee-pee dance of putting your legs together like that, it tilts the pelvis toward the supported side. So if this is a supported side, it kind of does that motion of tilting the pelvis. And it flexes the hip. Okay, the piriformis, right here. So it laterally rotates the thigh and it abducts. So again, bringing that out. Now the obturator internus and externus, as well as the quadratus femoris, believe it or not, they all kind of do the same thing. They laterally rotate the thighs. So they're taking that rotation outward, okay? I guess think about maybe when you're trying to sit and go into Indian style and your legs rotate out like that. Okay, so the muscles of the thigh. The pectineus, we kind of already mentioned. It adducts the thigh and it flexes the hip. The gracilis, we've already mentioned. It adducts the thigh and flexes the knee. The adductor brevis and adductor longus, they adduct the thigh laterally. They adduct the thigh, laterally rotate the thigh. Again, sitting Indian style and your legs kind of come out. And they flex the hip, so they bring the hip up. And then that's bone or insertion points. All right. All of these we've talked about. The adductor magnus, the hamstring with the semitendinous, the biceps femoris, and the semimembranous. And then the rest is bone parts. Okay. So that's the first part of our leg muscles.